Good morning, everyone. I'm here with Dr. Adil Shamji, and our health critic, and M.P.P. Stephanie Bowman, our rural affairs critic. This week, Ontario Liberals met with community leaders at the Rural Ontario Municipal Association, also known as Roma Conference. And we heard firsthand how the provincial government is failing on healthcare. What we heard could not be more clear. Doug Ford's reckless and deliberate plan to underfund hospitals and expand private healthcare is wreaking havoc on rural communities. Hospitals are running deficits. Hundreds of emergency departments in rural Ontario have been forced to shut their doors, and healthcare workers are leaving the profession or their jobs in hospitals because of the strain they're under as a result of the cuts. Staffing shortages are pushing municipalities to the brink of financial disaster as they turn to overpriced, temporary staffing agencies, and hospitals are wasting hundreds of millions of dollars that should instead be spent on new diagnostic equipment or clearing the surgical backlog. I heard firsthand troubling stories from mayors having to fight for their hospital only to see closures, or counselors desperate to attract family doctors to their towns, who are being ignored by this government. This morning, we just learned that 10,000 patients in Sault Ste. Marie have lost access to their primary care provider, all in one fell swoop. The government knew about this and failed to act. That's why today Ontario Liberals are joining our municipalities to demand that the Ford government take urgent action to support healthcare in rural and northern Ontario. And now I'll turn it over to Dr. Shamji to share more about our efforts to be the strong partner that rural Ontario deserves. Thank you.
Thank you. Bonjour tout le monde. Good morning, everyone. If there's one thing that I learned in my many years working as a family and emergency doctor in rural and remote communities here in Ontario, it is that when our healthcare system starts to falter, it is felt first in these northern, rural, and remote communities. And after meeting with so many municipalities this week, rural municipalities at Roma, I can say for certain that this fact remains the case. Rural healthcare is in crisis. Rampant ER closures, staffing shortages, and no access to primary care. As we learned just this very morning, 10,000 patients in Sault Ste. Marie will be notified today that by the end of May, they will no longer have a family doctor. Our sources are telling us that this family clinic reached out for help to the Ford government and got nothing in return. Doug Ford's indifference, inaction, and incompetence is actively making healthcare worse. And we can certainly say that to the people in Sault Ste. Marie. He never gives rural municipalities a seat at the table. When we fought to give them a seat at the table, when this government tried to introduce their healthcare legislation, like Bill 60 for out-of-hospital surgeries, or Bill 135 for a remodeled home care system, I pushed to get northern and rural and Indigenous communities to be able to have a say in those things. And Doug Ford and his government said no. He refuses to help build hospitals, even when local communities come up with their full local share. He won't help regulate or rein in temporary nursing agencies. This Monday, we learned that the town of Bracebridge's municipal levy, 5% of that goes to temporary nursing agencies when it could go to repairing infrastructure, helping with bridges, helping with homelessness. And Doug Ford offers no help on mental health issues, opioid supports, or supportive housing. And so today we're here to say it's time to tell rural municipalities that you matter. We are therefore calling for urgent action to support rural communities and rural healthcare. We are demanding that Doug Ford respond to all of the recommendations in the Auditor General report on northern hospitals, as well as the recommendations that came out of the Roma Conference on supporting rural healthcare. And there are two very important reports there with extensive concrete recommendations for Doug Ford to follow. We want rural municipalities to have a seat at the table, a seat at the Ontario health teams, so that they can have a say on their own healthcare decisions. We are calling on Doug Ford to regulate and rein in temporary staffing agencies, and we want to maximize health human resource support and staffing in the north for primary care, long-term care, and home care. I'd like to say that Sault Ste. Marie is a canary in the coal mine, but it simply isn't. We had the Minden ER closure a few months ago, thousands of hours of ER closures, and this needs to stop now. With that, we'll take your questions.
Well done.
Getting doctors is not an easy thing. You can't just snap your fingers. So what could practically be done right now, or what could have been done to offset this or prevent this?
I'll pass it off to you, Dr. Shamji. So, there are a number of things that need to be done from an investment standpoint. Right now, we know that over $185 million is being used on outside agencies rather than being invested in those hospitals. Some hospitals, the cost of outside agencies is $2 million, as high as $8 million that I've been reading. So that money could go into diagnostic equipment. It could go into clearing the surgical backlog. But at the same time, it needs to go investing in our healthcare workers. And so paying them a proper wage and attracting them and providing them the incentives. And I know Dr. Shamji has a plan, but I know it also includes a new medical school in the north, and perhaps providing free tuition that they could pay off over years with a multi-year service agreement. There are many ways we can continue to attract quality healthcare workers to our northern and rural communities. Dr. Shamji, would you like to elaborate further? Thank you.
Well, specifically as it relates to primary care, there are so many things that could be done. Number one, we need to maximize incentives to attract primary care practitioners to northern, rural, and remote areas. We need to train more of them in those areas as well. And I don't just mean having a medical school in the north. They need to, our medical schools need to be funded so that medical students, nurse practitioners can train in the communities that hopefully they will one day be able to settle in. And at a time when this government consistently underspends by billions of dollars, financial quarter after financial quarter, wastes hundreds of millions of dollars on temporary nursing agencies, when a clinic like the one in Sault Ste. Marie says that we need help and funding to keep our doors open, the government needs to say yes. And the only way that this government ever says yes is if it's to Doug Ford's friends.
Do you happen to know what specifically this clinic in the Sioux asked for?
I don't know specifically what they asked for. My understanding is that they asked for administrative support at minimum, but we have more information that we need to find out.
And what are some solutions that the government could possibly provide for these 10,000 people who will now be without a family doctor?
Well, if I were them, I would instantly come back and say yes to the request that they made, that this clinic made, increasing that funding, making sure there is a northern locum program. They're going to have to put a lot more funds into that on a short-term basis to get doctors up there. But truthfully, if I were the government right now, I would be standing right here at the podium, and I'd be on the phone talking to that clinic, not hiding behind closed doors. And it is that lack of leadership that is fundamentally the reason that we're here.
Can I just add something to that? After being at Roma this week and listening to also municipalities and groups in our pre-budget consultations, we hear that organizations have innovative solutions. And Roma specifically said, they want a seat at the table. They want to be part of the conversation. So I think, again, we have a government right now that makes mistake after mistake. The Premier says, I'm sorry, but it's costing this province. Under this Premier, our net debt has gone up almost $80 billion. And what do we have to show for that? We have failing ERs, we have failing healthcare, we have education workers in crisis, we have opioid addictions, we have homelessness crisis in every small town. So, every year we hear a new crisis at Roma. This year, it's healthcare. Last year it was the opioid crisis. It's not that one's gone away. It's just that they are desperate for these solutions and they want a seat at the table.
Yeah. One more. Can I? So yesterday, the government announced a big investment in healthcare. It was more pediatric and mental health care for children and youth. But what do you think of this initiative? Do you think it's going to cut it?
No, of course not. I mean, these were funds that had been committed a long time ago, and we were waiting to find out when they would get spent and what they would get committed to. It's just so typical of the way in which this government operates. You know, overpromise, underdeliver. It's always too little, too late, and it will continue to be. Unsatisfactory at a time when fundamentally the major issue that we have in our province is healthcare staffing, a shortage of primary care workers, nurses, and other healthcare workers that are leaving the system in droves. There's nothing but pin drop silence from this government.
Hey Bonnie, I just had a few questions about a few different topics. One on international students.
Yeah.
So the cap that was announced earlier this week, colleges and universities in Ontario are suggesting that it was too broad, that it treats everyone with the same brush, and that it will put a lot of these institutions at risk of potentially going further into some kind of financial ruin. Do you feel like the federal government went a bit too far with how they're applying this?
Well, let me first say that the federal government clearly felt that they needed to step in because they needed to clean up the mess that the Ford government has made. So let's start there. You know, I think that we feel that the Ford government has deliberately been underfunding our post-secondary institutions and making them dependent on foreign students and the revenue from those international students. So they've also removed all the oversight at all the private colleges, and as their efforts to privatize education and healthcare continues. And many of these students have been exploited, and we've seen the outcome.
But it was the federal government that was approving all of these study permits, and now the federal government has brought in this cap, and universities and colleges are saying that the federal government wasn't precise enough in how they applied it, not institution by institution. Rather, they're treating everyone the same as bad actors. Do you feel, though, that there could be some fine-tuning with what the federal government did?
Well, sure, but I think they're reacting because in 2019, the Ford government opened up the doors and allowed foreign students in without any oversight and without any capping. So finally, we've seen the results, and now the federal government has been forced to act.
What kind of fine-tuning do you think they should do? Should it be more institutional, or should it be more broad?
Well, there needs to be more oversight. There needs to be more funding to our post-secondary institutions. And we need to weed out the bad actors, because we know that clearly there are some that exist.
And just on another topic, official plans. So last year, the official plans were all obviously scrapped. I'm wondering, from Mississauga's perspective, you would have known the perspective on the ground, but a lot of other municipalities seem to have indicated, or some seem to have indicated, that actually they wanted those official plans or those boundaries expanded. Do you feel like the government kind of overreacted with official plans, or was it the right thing to do?
Well, no, the government overstepped, clearly. It should be the municipalities in consultation with their residents and stakeholders that create their official plans. They don't need plans imposed on them by a premier who wants to be the commissioner of zoning and planning. So that's what I see happened, and many of those urban boundary expansions have now been walked back.
Right, but do you feel at all that by taking away that land from some municipalities, from development, that it would make the housing crisis worse because there's not enough land now?
I think the individual municipalities have to make those decisions on what's right for them and if it's appropriate to put housing. As you know, I was chair of the Big City Mayors of Ontario, and we let the Premier know that all the housing targets can be met within the existing urban boundaries, that those boundaries did not need to grow.
Okay, and just one last topic. Bill 124, civil servants are now also getting retroactive pay. I'm wondering what you would do if you became Premier in 2026 when it came to Bill 124 or any other kind of contract negotiations that come up. Would you ever impose salaries or wages or contracts on any union?
Well, the very people that we called healthcare heroes during COVID were imposed a 1% increase when we were in the middle of a high inflationary time. So, of course, we've all said that we would have repealed Bill 124.
Right, but the Liberals did, under Kathleen Wynne and Don McGuinty, impose a contract on teachers, as an example. What would you do if you were the Premier? Would you rule out the imposition of a contract or the imposition of any wages if you were the Premier, or would that be something that would be open?
So I do believe in collective bargaining. Let me make that very clear. So we have to engage and bargain, go through the bargaining process, and I'm quite certain that we'll have the right people on hand, that there will be successful negotiations at the end of it. Thank you.
The government is pointing out in 2015, the previous Liberal government cut 50 medical residency positions, which was controversial at the time. So, was that, in retrospect, was that a bad move by a previous government?
Recall?
I don't recall that personally, and I can't comment on the factors at the time that led to the decision, but I can comment on a spate of bad decisions by the current government. Bill 124 would be a big one. Making family medicine so unattractive that even if the seats that we have, we can't fill half the residency positions until we, go to second and third round matches, or can't fill it from students within our own province. There is just one thing after another. A series of bad mistakes on the part of this government, and so I think they can look back in time as far as they want. I mean, they're very happy to do that rather than deal with their own massive shortcomings.
Or look forward.
There you go.
Everybody good?
No, can I just one
Sure.
more? So sorry. So the thing is, I was taking a look here, and apparently Ontario is the province who has the most international students in Canada right now. And with the capping, I was wondering, because it's also the province where students graduate the most in healthcare. So how the capping on international students might influence the need of doctors here in Ontario?
And doctors. I think what will be influenced largely is the career colleges, and it may help weed out some of the bad actors, because 30% of international students have been cut, but the majority of them, as you've described, about 50% will be in Ontario, that they'll be cut to the flow. So the career colleges may suffer, but we're hoping there will be negotiations and discussions so that the other colleges, the Seneca colleges and the Algomas, etc., Mohawk, will survive, but they need more funding, and that's clearly the issue. They've been invested in to date, and that's why they've had this reliance on foreign students. So we need the funding to go up. Please.
When this government sees international students, they don't see future healthcare workers. They just see dollar signs. If you want to talk about bringing in healthcare workers, foreign healthcare workers, and foreign students who could become healthcare workers, then all I would point to is the massive number of internationally trained doctors that are unable to get licensed, unable to work in our province, unable to access a practice-ready assessment program. A practice-ready assessment program, mind you, that Ontario Liberals had introduced, that Doug Ford cut immediately upon coming into power, that Sylvia Jones has been talking about bringing back since August 2022 and has taken zero action on. If we want to harness the potential of international students and international trainees, we don't need to do that by taking predatory actions on international students. We need to welcome those that are right here within our midst and help them go to work, because we need their help.
Okay, no further.
Thank you very much for coming today.
No further questions. All right.
Great, thank you.